In the quiet corridors of hospital and bustling rooms of homes, there exists a world that often remains unseen, yet profoundly felt. In this documentary, we embark on a journey into the hearts of those whose lives are intertwined with illness, those who offer solace, wipe away tears, and find strength in the face of adversity. Join us as we unravel the complexities of caregiving, the nuances of empathy, and the profound impact of understanding in the world of healthcare.
माझ्या लेकाचं दुःख होत होतं तर 50,000 कर्ज झालं. 2-3 महिने ठीक राहिलं. आता पुन्हा दुखायला लागलं. तर आता आमच्याजवळ पैसा नाही, त्याच्यासाठी इथं ॲडमिट केलं गुरुवारपासून. आता आमच्या घरी ब्लॉक आहे, जवळ पाणी नाही, पाऊस नाही, शेतीत माल नाही, पाणी नाही, कुठून लावणार आम्ही पैसा. बाहेरून आता कालच्या धरून 1,500 मेडिकल होत आलं. आणि आज मी म्हणलं मी डब्याला परत जाते घरी, तर मला जाऊ नको म्हणे, मग आपलं जास्त दुखतं. आणि मग आम्हाला आता दुसऱ्या चुलत नातेवाईकांना डबे आणून दिले दोईटे. त्याचं जास्त तब्येत जरा बिघडेले ना, त्याच्यामुळे तो म्हणे आई मला सोडून जाऊ नको.
पहले हम औरंगाबाद गए थे, वहाँ पे अमन बताए तो उन्होंने बोले 60-70 हज़ार रुपये खर्च आएगा. फिर इधर आ गए तो यहाँ आने के बाद 1-2 टेस्ट करा दिए, 1 दिन थे. फिर हमारा वो करके लाने 2 दिन गए तो वहाँ पे दवाखाने में 3,500 हमारा खर्चा आया. फिर आहिस्ता 2-1 हज़ार ऊपर कमी ला के 5-7 हज़ार खर्चा आया. फिर उसके बाद यहाँ ला के एडमिट करे तो यहाँ लाने के बाद भी 1-2 दिन 3 दिन से यहाँ चाहिए. यहाँ भी मेस का खर्चा, जितने दिन ज़्यादा रहेंगे उतना खर्चा ज़्यादा बढ़ रहा है. जल्दी से जल्दी हो गया ऑपरेशन तो अच्छी बात है, कमाने वाले हम ही चाहिए घर में.
Around 60 to 70% of healthcare expenses in India were paid out of pocket by individuals and families, indicating a significant financial burden on households. Healthcare expenditure of around 90 million Indians has crossed the catastrophic levels, a state of financial conditions where health spending exceeds 10% threshold of household consumption, posing a threat to maintain housing needs. According to National Health Profile, healthcare expenditures pushed 7% Indians below the poverty line and 23% can't even afford treatment.
पेशेंट यहाँ जो आते हैं मोस्टली बिलो पावर्टी लेवल रहते थे और अनएजुकेटेड रहते हैं. अब उनको थोड़ा प्रॉब्लम इस टाइम पे होता है कि रिपोर्ट्स के लिए बार बार भाग दौड़ करना पड़ती है, मेडिसिन का भी एक टाइम पे नहीं मिलती, तो वो थोड़ा परेशान उस वजह से होते हैं. कुछ ये रहते हैं कि भाई पूरी मेडिसिन हम हॉस्पिटल की तरफ से मिल रहे नहीं, पैसे लग रहे, उन कुछ की ये सोच रहे.
Caregivers often experience high levels of stress due to the demands of caregiving, leading to physical and emotional exhaustion known as caregiver burnout. It includes symptoms like frustration, extreme tiredness, anxiousness, depression, and feeling hopelessness. Caregivers often prioritize the patient's need over their own, which can lead to decline in their health.
मेरा जो लड़का है सैयद मोहम्मद, उसको फीड आया था, डायरेक्ट यहाँ पे ज्वाइन किया हमने. ब्लड की चेकिंग करें तो उसमें WPC वगैरह प्लेटलेट बढ़ के आया हुआ है, और शुगर भी थोड़ी बढ़ के आई हुई है इसमें बच्चे की. हीमोग्लोबिन का भी कुछ प्रॉब्लम बताया हुआ है. और वो जो फिट आई थी इसके बाद से ज़्यादा केयर करे थे हॉस्पिटल ने. इसके बाद से बैक में तो पानी निकाले थे, हाँ उसकी जांच किए और अल्हम्दुलिल्लाह वो जांच नॉर्मल आई हुई है. तो अभी फ़िलहाल उसको खून जो कम है के लिए और जो बुखार कंटिन्यू रह रहा है उसके लिए ट्रीटमेंट चालू है. हाँ खाने का बहुत प्रॉब्लम सर उसका, यानी कि अभी 18 महीने का बच्चा है, वो चबा के नहीं खाता हो, तो उसको रोटी हम ग्राइंड करके उसमें थोड़ा मिल्क डाल के देते हैं.
Prolonged caregiving can lead to mental health issues such as depression and anxiety, affecting the overall well-being of the caregiver. A study says that whopping 39% caretakers experience symptoms of bad mental health. As we bid farewell, let us carry these stories with us. Let us remember the exhausted caregivers who, despite their own weariness, continue to stand by the loved ones, reminding us of the profound impact that empathy and understanding can have on the human spirit.
So how does it feel to be a patient's relative? So patients are coming to us for a variable problem, starting from a minor episode to a serious problem that is a life-threatening episodes also. So if I advise admission to any sick child who is having moderate to severe illness, so this is a really challenge for the family, because the whole family will be disturbed once I ask them to admit the child. So depending upon the severity of the illness, I need to assess the child, and I need to explain them the severity of the illness of a child, and accordingly I will advise regarding the treatment plan of the child. Okay, so parent psychology, they have a multiple issues like a financial issue. As we know, it's a totally free hospital. Okay, so first thing what we would usually do is reassurance to the family. Okay, so this is a child is having moderate to severe illness, but at the same time the patient can be managed here. So it will take a variable duration of time, starting from 2-3 days to a week, or maybe a more duration depending upon the illness. So we always give them a realistic assurance the patient will be okay. We handle them empathetically, thinking as their illness as our own illness. Okay, we give them reassurance and full confidence that this child will be managed in our hospital, and we will discharge him after a couple of days.
As per the competency number 2.8, the student have to study about the attitude, ethics and communication. So what we mean by this, that we should have a good communication skill with the patients and with the relatives. What it means to be the patient's relatives, why we should understand the psychology of the patient and the relatives. Just for giving the example, if a patient comes with some chest pain, there are a lot of relatives accompanying the patient, and all these patients' relatives, most of them are in panic situation. So when they meet us, as a doctor, we should understand that they are in pain because of the patient. So we should not behave abruptly or wrongly with these relatives, because we should understand that they need psychological support that time. They need a good communicator from the other side. So we should analyze that if that patient is our relative, how we are going to behave with the doctors and what we are expecting from the doctors that time. And that we should understand. Then only we as a doctor can understand the psychology of the patient's relatives. So our first job is to make them calm, to try to make them understand the situation, explain the situation properly so that they can cooperate with us, ask them to move away from the patients for the benefit of the patient. If, for example, if the patient is a small children, then try to send the relatives away, but parents should be there. So the patient should also feel comfortable along with her parents. For us, it is just one patient. If you are saying 100 patients in a day, it is one of the 100 patients. But for relatives, that is the only person who is suffering in their family. They want to relieve the pain of the patient. That also we have to understand that it is a natural phenomena. When God has given us the emotions will come out. If there are no emotions, then a lot of things will not be proper in this world. So we should make more and more adjustment with the relatives. We should try our best. So the main thing is communication. Try to understand their situation. Try to understand the agony which they are going. Sometimes they may be waiting there for 1 hour for a small thing. So all these things should be taken into consideration. Even if the patient is not concerned with us directly, we should still communicate with them properly.
So you already saw how our very, very enthusiastic students have prepared this beautiful documentary, which is an education in itself, as it teaches us about some aspects of professionalism. Initially, professionalism was taught as a hidden curriculum during MBBS curriculum, but now it has come up as a day-to-day activity, day-to-day teaching and learning activity. And this is an AETCOM which gives a sense of empathy, teaches empathy to our medical students, and this empathy also adds up to the base of altruism, as is seen in most of the medicos. So our students are very active in bringing out all the teaching and learning activities as which are concerned with professionalism and communication. Thank you.
To you, the healers, the caregivers, the future architects of health, this documentary is more than a collection of moments. Let them serve as a constant reminder that your expertise is not just in diagnosis and treatments, but in the simple act of being there, listening, understanding, and caring. You are not just bearers of knowledge, you are guardians of empathy.